Well, Councilman Bernard Parks, who endorsed me, has used his discretionary funds to fix the sidewalks and potholes in District 8. I would do the same. I would use my discretionary funds to fix more sidewalks and potholes instead of having to wait 40 years as the Business Bureau of Sanitation and Services, BSS, of the City Department is saying. We can get things done a lot quicker.
Thank you. Dr. Smith.
I would use a part of that for that purpose of fixing the sidewalks and the infrastructure. I would spend the other part of it developing a healthcare co-op plan. That would be a health plan for Los Angeles, whereby I believe it or not, as it turns out, they say that, especially with given our aging population, but if they say the healthcare industry is like $1 trillion industry, but when you look at what's being paid to the healthcare providers, 10%. So what about the other 90%? Well, that gets back to, like I started to say, there's a lot of duplication. There are hundreds and hundreds of thousands, I should say, of insurance companies and third-party administrators across the country. What the president had attempted to do with the single-payer plan was to expand Medicare to everybody, because Medicare is the most cost-efficient means of delivering health care. There are no investors to pay. The plan that I have in mind would be cost-efficient because, once again, healthcare doesn't cost what it should cost once you remove the insurance companies from we would need insurance companies from the hospitalization component and for higher-end services, MRIs, things like that. But as far as outpatient services go, you would find a precipitous drop without insurance companies being, if doctors could be paid directly for their services from our health plan. And once again, with an aging population, I would propose also that we develop a LA City Department of Health. Right now, we're 49th. Doctors are getting paid, that is from Medi-Cal. Well, what happens, all the money comes from the same source, the federal government, but what happens is the money goes from the federal government, from Medi-Cal to the state. Half of it disappears at the state level for administrative costs, and then what's left of that half goes down to the counties, and the counties take half for administrative costs, and then what's left is paid to the doctors, leading doctors.
She's going to scream out, stop.
49th in the country, 48th.
Thank you, Dr. Smith.
Okay, so once again, we go back to the policy end of what City Council is supposed to do. If we have a master plan in which we envision, people going to their local small business, we also need to have residents living there who can walk to, hopefully, or not find it difficult with lack of parking. We can plan for this. We can entice people to create the affordable mixed-use type development that benefits everybody. There's two different large complexes on Vermont and Wilshire. There's the northeast corner and the southeast corner. The northeast corner received CRA funding and therefore created 20% of those units in there as affordable units, meaning the price is lower. The southeast one received $17.5 million, and there isn't a single affordable unit in there. When we use government money wisely, we can have more affordable housing. We can also create incentives to build housing in the district. And I've heard from the people who are upset about the mansionization of some of their neighbors' homes. We need that master plan, so if this is something that everyone wants or doesn't want, we're a democracy. It's the majority rules. But people aren't being engaged. They don't know how to engage. I would work towards that engagement.
With the present dynamics in business, whereby as a state we're hemorrhaging, losing jobs to other parts of the country that have a more business-friendly tax base. We have to, before we can talk about affordable housing, we have to do something about the job situation. People, a lot of people, there's a high percentage of people right now that, especially in the black community, that don't have jobs. And so what's affordable when you don't have a job? And so it gets back to, once again, I think we have to focus, we have to be more, when I was growing up, it used to be, buy, USA, because what happens, and it grew we grew as an economy. I think in our case, it's going to have to buy LA, buy in LA, buy what you can, support our local businesses. Right here in our own community, the contracts right now that I talked about, billions and billions of dollars a year, and more of those need to come back to our local businesses. That would stimulate more jobs and with more high-paying jobs. And then with those jobs, then housing will become more affordable. In addition to that, as Grace touched upon, there should be some kind, or maybe she didn't, but that's sort of what I heard, that there should be, ideally, I believe, some sort of a formula that works, that if you're putting up, substantial housing, then some percentage of that needs to be set aside for lower income.
Dr. Smith, these questions I'm going to try.
I just told you I would cut tax. No, but once again, okay, just to back up once again, I talked about, reducing taxes. I talked about no taxes for new businesses for the first 3 years, and reducing taxes by as much as a third for those businesses that are already existing. So how do you accommodate for that with a shrinking tax base? The answer to that question is simple. Once again, you redirect the procurement process, or you restructure the procurement process when these contracts come up for county and city contracts. And if a business is located within the city's borders, or the fact that you're in the city as a business, and a significant number of your employees is presumed will live in the business, will work in the business, that you should be given priority points. We could generate income from another source, as I mentioned, having our own health plan. We would generate, that would turn, over the 12-year period that you talked about, that would turn Los Angeles probably into one of the largest insurers in the world. And with that comes income. And it would be, the premiums would be a fraction of what we're paying right now for insurance premiums. I've already created the plan that Aetna administrators have reviewed that says the most cost-efficient means of delivering health care that they've ever reviewed. It's already in existence. It's called the Community Healthcare Cooperative Pilot Project Plan. So it already exists. Thank you.
If you could please repeat the question.
There are a couple of proposals to address the city's aging infrastructure, some involve increasing the sales tax. Would you support that, or what is your alternative for financing improving the city's infrastructure?
Okay. The city's budget is approximately $8.1 billion. In the 2014-15 year, we are looking at a deficit of approximately $164 million. They have already been working on the 2015-16 budget, and they're now saying that's going to be closer to the $250 million deficit. So your first question to me is sort of, do I believe that increasing sales taxes will allow us to build more infrastructure? And I think, I don't know for a fact right now, but I'm leaning to say that is not going to be the right solution. Because when you increase sales tax, we are not a city that is so far from Glendale or Burbank or Culver City where people can get large ticket items at a lower price. So instead of us selling cars in the city of LA, they're going to go to Glendale. They're going to go to Culver City, they're going to go to Burbank instead of staying within the city of LA and pay more taxes. It's one thing if you're going to go buy, you know, a drink at the local store. You're not going to go driving an extra 10, 20 miles to save on that sales tax. But when you're buying something that costs $30,000, that half a cent, that 1% sales tax is significant. So how do we work on this? We've got to find where all the inefficiencies are. We've been told that the city has places in which monies have not been received in full. Well, then we better go collect. We need to bring down the deficit. The infrastructure is something that needs to be prioritized. And maybe just like olden days when they would go ahead and create jobs for people within the district, that could be used. That way we're saving people.
Thank you.
As a former attorney for children, representing children who need special attention because family members aren't able to take care of them, I know how important after-school activities are, as well as the school you attend. Some of our schools in the district are high API achievers, and some of our district schools are not. I think if we can bring in the tutorial services that USC, UCLA, Loyola provide, I think that if we can get better mentors for our kids, our younger students from the college age group, that peer mentorship will be beneficial. Giving back is always more of a blessing to the person giving than the person receiving. And so I think the college students here, when you're being mentors for students who need a little extra help in math or physics or English, you get to know them as people and some of the struggles that they're going through. And then you're going to want to help. There was a young woman who, you know, it was a YouTube thing, right? Where she ended up creating a sleeping bag that was actually a jacket, right? But the homeless person said, I don't want this jacket, I want a job. And so she ended up creating jobs for former homeless people. I think young people have a better vision because they don't understand things cannot be done. You believe you can do it and you go for it. I think some of us who are a bit older, we're too wise. You know, can't be done. So we have to have the young people change it for us. We can make our district better by bringing in different ways to improve the lives of our kids.
Dr. Smith? Regarding public schools, many residents send their children out of the district or to private schools in the area. So how would you work with the LAUSD to improve the public schools within the city of town?
Well, when it comes to education as a professional student, as I was once called, I think that perhaps we should take, well, when I grew up in a time when I would put it this way, I was fortunate enough to grow up in an area where I was able to travel to a better school. And so perhaps we should have, you know, maybe years ago here even in Los Angeles, there was some kind of exchange programs where students there would be some sort of an exchange process between the schools. I think before we can talk about improving schools, and that's really hard to do right now when you have a gang situation whereby students are afraid to walk a few blocks without having their lunch money taken. And so a lot of those students are staying at home in certain communities right now because of the gang situation. And so I think we have to address the gang situation that are keeping a lot of kids, you know, away from the schools. I think we have to think about, and certainly if you don't, maybe shift the teachers around. If we can't shift the students, it might be a better idea, maybe we could try some program whereby the teachers actually go in some sort of a rotational schedule, to be sure that everyone is given a fair chance at a decent education. All teachers are not the same. All teachers are not equal, and so maybe that's the solution. But right now, it's a very difficult problem that you've raised, and it's a multifaceted problem. We have to take the fear out of going to school for some of these kids, and once again, I think we should have a more homogeneous, some kind of a teaching plan to assure that there's some more quality in education is being provided right now.
Thank you.
I don't see that many. A lot of what I see, just as a casual observer of that, is that the people seem to be passing through the community on those trains, going wherever it is they're going. So I don't. Maybe the part of the reason is that we don't have I'm sure that the endpoint for many of them will be Culver City. There are a lot of restaurants, a lot of things to do in Culver City, and we just don't have those kinds of attractions here. So right now, as the community exists right now, I see it as those trains, people on them for the most part going someplace else. They're not, necessarily coming here to spend their money, and that's why we have to attract businesses to the district. We have to, like I said, that can be achieved by revising our present tax base. We have to, I think that's the biggest factor. We have to do something whereby we can stimulate growth of our business community. And then they'll have a reason to get off of those trains and come, and spend money here in the district. Right now, a lot of that just doesn't exist. But I'm glad I haven't been in this restaurant in many years, but I'm glad that I came through here, and this is a place. This is an excellent. I have to say that this is an excellent location. I believe that if people knew about it, anybody would come here. This place has a lot of potential, and there are many of our businesses that, such as this, that exist within the district if given a chance. But once again, I think we have to do something to stimulate more of what we see here. This is what I'm talking about. If we had more of this, then you'd have more people getting off the trains to spend money in our community.
Ms. Yu.
The EXPO line and the CRENSHAW line, I believe, brings great potential for financial incentives for new businesses to come in. We've got to figure out a way to make people come and stop. I was told in the Lumber Park area, by bringing in the Christmas tree, it made people want to bring their children, just like the Grove does, right? When you have something pretty, people want to come. Then they're going to spend time there and spend their money in the local businesses. We've got to have some kind of catch. I'm not sure what that is at this moment, but we can find a project or an event or a weekly or a monthly event. Take weekly back. That would be hard for anyone to put together. I know the Pico business area, they do that. They bring this every third Thursday evening, generating more income for the neighborhood and places for people to come by bringing in food trucks. And it's like a party. Having people come into their small mom and pop shops, and they have desserts for them, they have punch for them. It's much more of a festive kind of atmosphere. So these business people came together and wanted to generate more income for themselves, and they did business a little differently. I think you've got the potential for something huge. We just have to figure out what that one thing is so that this can be the mother lode for the area. Well, I was an executive director in a nonprofit. I didn't see a penny. I wonder which organizations received this $42 million. Does it say? I don't think so. You know, nonprofits cannot be nonprofits when they do not follow the 501c3 code and when you're doing things that require it to be shut down. Yes, I'm saying something really horrific right now because I'm saying DWP, we want to know how that money was used. I think our residents want to know. Our utility rates are set to go up once again because we don't have enough money. But they certainly seem to have a lot of money to use on political campaigns. It seems that their accounting has been very lacking. There is no transparency. And in city government, everybody knows you should go work for DWP because you're the same pay grade level, but you get a 20% pay raise by just working for LADWP versus any other city entity. That's the little known secret that everybody talks about. So we're not doing the right thing. We need to figure out how to make sure that people, when their salaries are raised, it's relatively the same with other areas. Just because you work for the city doesn't mean your pay gets to be higher than other public utilities in the area. I think that 42 million needs to be accounted for, and I'd like to know where it went, just like everybody else in this room.
Yes, it definitely needs to be accounted for, but if you look at the letter from the internal auditor of the Department of Water and Power, $42 million is chicken feed. As far as money that needs to be accounted for by the Department of Water and Power. As Grace mentioned, corruption abounds to such an extent, I believe, and I'm from Chicago, I believe that LA is more corrupt, and I can tell you the reason why. When I was growing up, if you were on the wrong side of the law, you got caught on the wrong side of the law, you knew you had to come up with two fees. One for the attorney and another one for the judge. It was just a given. Here in Los Angeles, the county of Los Angeles, they give the judges a $60,000 a year tax-free stipend. So what do you think that does for when the county goes before a judge? It's almost impossible to win. There was a California appellate court ruling that said that was unconstitutional based upon the state constitution. And there was an attorney who tried to fight to turn it over, or who opposed SBX, his name is Fine 211. He was put in jail. There's a case right now that I have before I told you I'm a civil surgeon for the United States government, and under the case it's People of the United States versus Los Angeles County. There's a case right now before the United States Appeals Court whereby it's unconstitutional, but not the California Constitution. It's unconstitutional from the standpoint of the United States Constitution and its statutes. There are statutes that require judges to make disclosures that if the financial disclosures, other disclosures that could, in any case, there could be a perception of bias.
Time is up.
There are federal statutes that state statute violates.
And while we have many more questions, which we'll be sure to get to the campaigns, that will have to be in.
Somehow, we've gone astray here in this city and in this district especially. There is so much room for improvement that I know as your city council member, we're going to make those changes. We're going to set a new standard in the city. I'm excited about this new sidewalk posting to get all the residents to figure out which one needs to be fixed first. We're going to have discretionary funds to fix sidewalks. It's not going to take 40 years. We're going to do it sooner. It's not everybody's sidewalk, I'm sorry. But we're going to get engagement, and you're going to get a city council member who's going to come to your neighborhood and give time, and my staff will be responsive. I will be responsive. I care about our budget. I'm not gonna kick it down the can and say someone else needs to figure it out. I'm gonna go in there, I'm gonna look at those numbers, we're gonna balance that budget. It's doable when you go in with the attitude of fixing a problem. I'm going in to fix a problem, and I'm hoping for your vote so that I can make this happen. Thank you so much.
Like Grace, I am also looking for your vote. I know that we can do better. We have an aging population in Los Angeles. Healthcare, more and more, is becoming an issue. We have the threats, like I said, Ebola and various other infectious diseases that are more and more becoming a threat. Even our own drinking water is thought to be a threat, or it will soon be a threat, if they continue this process without transparency, without making the water analyses available. We need someone, I believe, with a medical background downtown to make these healthcare, whether becoming more and more increasingly healthcare decisions. I think we need someone with a medical background to make those decisions. If I had been downtown, there's no way that this toilet to tap business would have been able to fly without my constituents knowing something about it. That, hey, we got this coming down the pipe. They're talking about, because of the astronauts. They said it's good enough for the astronauts. Well, the astronauts weren't taking a lot of different, but you have to be pretty healthy to be an astronaut. So they weren't taking, there's some people on 15, 20 different drugs, one person, and that's ending up in the water system. And that system that's available now is not filtering those things out. And so, like I said, we need somebody downtown that can make decisions, that have some medical knowledge, because these questions are becoming more and more healthcare related. We need our own health plan, we need our own Department of Health, and those are things that I can do for you, and I look forward to the opportunity. And thank you for your vote.
Thank you very much, Nick. Let's give you both a round of applause. Our city turnout in these elections is historically low.